Hello, my name is Byron Marciniak. I am a first-year internal medicine resident at UAMS Northwest Regional Campus up at Washington Regional in Fayetteville, Arkansas. This is my presentation for my poster titled Abiotrophia defectiva, a rare cause of infective endocarditis. Infective endocarditis is a life-threatening disease that can be caused by many different bacterial organisms. Abiotrophia defectiva, also known as nutritionally deficient streptococcus, is an easily missed, often culture-negative, cause of infective endocarditis. Abiotrophia defectiva is considered normal oral flora, but can also be found in the genitourinary and intestinal tracts. This case report specifically highlights the importance of early identification and prompt treatment of Abiotrophia defectiva infective endocarditis. This particular case involves an 80-year-old male with a past medical history of coronary artery disease, aortic stenosis, hypertension, anemia, and type 2 diabetes. This patient presented to the emergency department with complaints of progressive weakness for 2 months and poor oral intake for the past 2 days. The patient was found to be tachycardic with a heart rate of 108, but was otherwise afebrile and hemodynamically stable. Our lab testing revealed a pro-beta natriuretic peptide of 6,284, as well as a high sensitivity troponin of 23.7. However, this subsequently did downtrend. This patient's EKG demonstrated normal sinus tachycardia with left atrial enlargement, and the patient's blood cultures obtained on admission initially grew gram-positive coccyine chains, and at this time the patient was started on IV vancomycin. Ultimately, this patient's cultures isolated Abiotrophia defectiva, and the susceptibilities found that this particular strain was sensitive to both penicillin and ceftriaxone. So this patient was transitioned to 2 grams of IV ceftriaxone daily. Initially, a transthoracic echocardiogram was performed and was negative for endocarditis. However, because of high clinical suspicion, a transesophageal echocardiogram was performed and did find vegetations on both the mitral and aortic valves. Here in this picture, we can see the vegetation that was found on the mitral valve, and down here we can see the vegetation that was found on the aortic valve. This patient remained stable, and he was discharged on a 6-week course of 2 grams IV ceftriaxone daily. The reason early detection of Abiotrophia defectiva endocarditis is important is it has a high mortality rate that is statistically similar to Viridin's group Streptococci. Infective endocarditis, unfortunately caused by Abiotrophia defectiva, is commonly culture negative, as the bacteria can be difficult to grow and isolate, often requiring specialized media. So when the suspicion for infective endocarditis is high and cultures are negative, a 16S rRNA sequencing can be used to accurately isolate Abiotrophia defectiva. As far as treatment goes for this particular infective endocarditis, a 2015 article from the American Heart Association recommended that for infective endocarditis caused by Abiotrophia defectiva with a penicillin MIC greater than 0.5 micrograms per milliliter, ampicillin or penicillin plus gentamicin, or alternatively, ceftriaxone combined with gentamicin should be used. The European Society of Cardiology guidelines, however, differ in that they recommend 6 weeks of penicillin G, ceftriaxone, or vancomycin combined with at least 2 weeks of an aminoglycoside. A 2016 study from the American Society for Microbiology has shown that at a MIC breakpoint of less than 1 microgram per milliliter, only 10.8% of Abiotrophia defectiva isolates were susceptible to penicillin, and it did find, however, that 100% of Abiotrophia defectiva isolates were susceptible to ceftriaxone, vancomycin, imipenem, and meropenem. So at this time, it seems that there is not a unanimous answer to what would be correct antibiotic therapy. However, there is enough data to make accurate evidence-based decisions on antibiotic choice and length of therapy. Overall, quick identification of Abiotrophia defectiva endocarditis and early initiation of antibiotic therapy is highly important as it has an aggressive nature and high mortality rate. Thank you for your time.